Hi, my name is Courtney Wu, and I am thankful to be speaking at the Food and Nutrition Conference and Expo, or FNCE for short. I will be presenting my capstone project entitled Effective Elements of Group-Based Diabetes Education Programs, a Systematic Review. Before we begin, I would like to review the presentation outline for today. I will begin with the speaker introduction, present and review the learning objectives, review a brief background of the topic, present the research question, review the methodology and data, discuss the results, and conclude with the future implications of the findings of this research study. To introduce myself, again, I am a registered dietitian, and I am currently a Master of Science candidate at the University of New England. I currently hold a graduate certificate from San Francisco State University, where I also completed my dietetic internship. I graduated with a Bachelor of Science from Point Loma Nazarene University, and my current clinical work experience includes skilled nursing, outpatient counseling, and inpatient eating disorder experience. As you may be able to tell, some of my interests include diabetes care, and some you may not know, I am also interested in the gut microbiome and eating disorders. If you have any questions, my contact information is listed here as well. Objectives and learning need codes. After this presentation, you should be able to compare various forms of group-based diabetes management programs, examine the literature for qualities of effective diabetes management group-based programs, and then determine elements to consider when developing educational programs. The learning level for this presentation is level 1, and the learning need codes for the Academy of Nutrition and Dietetics continuing education requirements include adults and diabetes mellitus and education theories and techniques for adults. So a brief background, as many of you may be aware that diabetes is a prevalent disease in the United States and across the globe. Currently, 1 in 2 people with diabetes are undiagnosed in the United States, and diabetes continues to be a concern as it is a cause of 5 million deaths as reported in 2015. The treatment and management contributes to increases in healthcare costs as well as the increased complications of diabetes. Therefore, there is a need for exploration of alternative treatments for type 2 diabetes, especially in adults. One of the treatment methods for diabetes includes education, in addition to medication and other lifestyle changes. But group programs are a popular form of education for diabetes, and diabetes group education programs have been shown to improve glycemic measures in adults with type 2 diabetes. Group programs are also a form of cost-effective method of treating and managing diabetes. Therefore, this brings us to the research question at hand. What are the elements of effective group-based diabetes management programs that are effective in improving glycemic measures of fasting blood glucose or fasting plasma glucose and hemoglobin A1C in adults with type 2 diabetes? The first part of the methodology that we will review is the selection criteria for the systematic review. I have listed both the inclusion and exclusion criteria on this slide, and therefore I will not read it verbatim. However, points that I would like to highlight include the target population, which includes the age, so that is specified as 30 years or older, and including 70 years and younger within this range. The reason for this age range and not including those with type 2 diabetes diagnosis as 18 is that because this is a more narrowed life stage, and those who are 18 years old may have different life experiences than those who are 65 or 70 years old. Therefore, in group settings, a smaller age range may be more suitable. As far as the setting, the target population should be community living and free dwelling. And again, the focus of this review is type 2 diabetes and non-hospitalized. Preferred the randomized controlled trials, as this is the gold standard of primary research, and the year range selected for this study was 2012 to 2018 to include the most recent and up-to-date evidence-based practice. Some of the exclusion criteria to highlight were diagnosis of pre-type 1 or gestational diabetes, as well as other forms of intervention of telehealth or individual counseling, as the focus of this review is group-based programs. And here is the flow diagram, which demonstrates the process of reviewing the records. The databases that were searched included PubMed and ProQuest Central, and some of the search terms that were used include type 2 diabetes mellitus, group education, group management, DSME or diabetes self-management education, and glycemia and glycemic to focus on the clinical outcomes. After the search, there was a remainder of 4 studies, as some studies were not open access, were not in the English language, and included ages or conditions outside of the inclusion criteria. The first study that I will review was conducted by Aliyah et al. In 2013 in Iran. This is a simplified data table that shows the purpose, the population, intervention, and outcome data, as well as the conclusions of this study. The purpose of this study was to examine the effectiveness of group education and nurse telephone follow-up in controlling blood glucose and increasing adherence to treatment. The population was a total sample size of 62, and the percentage of male to female ratio was fairly even. This intervention included 2 60-minute face-to-face group education lecture sessions in 2 consecutive days discussing diabetes knowledge, complications, and self-care, as well as insulin management and self-monitoring of blood glucose. And the follow-up calls were conducted by a nurse 16 times over the course of 12 weeks. This intervention was in comparison to a control group who received conventional treatment. As far as outcomes, there was a mean difference in the experimental group for hemoglobin A1C, and the reduction of hemoglobin A1C was significant from the experimental to control groups. There was also a change in fasting plasma glucose, and that was a reduction significant from the experimental group to the control group. In the end, the authors concluded that the group education with telephone follow-up and group based strategies actually improved glycemic measures and adherence to treatment recommendations for adults with type 2 diabetes. Therefore, both hemoglobin A1C and fasting plasma glucose levels improved in the experimental group. The second study reviewed was conducted by Mash et al. In 2014 in Africa, and similarly, the purpose of this study was to evaluate the effectiveness of group education led by health promoters for adults with type 2 diabetes in community centers. This was a larger study as the total sample size is 1,570, and the intervention included 4 60-minute sessions of group education about diabetes, healthy lifestyle, medication, and complications, again led by health promoters. This was in comparison to the control group who received usual diabetes care at the health centers. The outcome data indicated a mean difference in hemoglobin A1C between the groups that was insignificant, and the reduction in mean hemoglobin A1C was from 8.9 plus or minus 2% to 8.4 plus or minus 2% from the intervention group. The authors then found that there was no significant effect of group diabetes education on glycemic measures after the 12-month study period. The other clinical outcomes that these authors studied related to systolic and diastolic blood pressure, which were significant. However, those outcomes were not documented in this study because the focus was on glycemic measures. However, it is a point to consider when developing clinical outcomes for the group education programs. The third study was conducted by Torres et al. In 2018 in Brazil, and the purpose was to evaluate the effect of diabetes mellitus education programs in primary care on glycemic control. The total population sample size was 470, and the intervention was conducted in basic health units in Brazil. The intervention group received group education led by a nutritionist and a nurse for 3 2-hour sessions once a week for 3 weeks. The group education intervention received the education on healthy eating, physical activity, and self-care practices, as well as goal setting. This was in comparison to the control group that received educational practices that were standard for the basic health units. The outcome data measures were taken at baseline, 3, 6, and 9 months. So this was a 9-month study period. At the 9th month, or the completion of the study, the mean hemoglobin A1C of the intervention group was statistically lower than that of the control group. However, in the intervention group, hemoglobin A1C increased from baseline to the 3rd month and then decreased at the 6th month and the 9th month. The starting hemoglobin was 7.88 plus or minus 2.19% in comparison to the final measure at 7.9 plus or minus 2.06%, which was not a significant reduction over the 9-month period. The authors concluded that results indicated that the group education contributed to the maintenance and then ultimate reduction of hemoglobin A1C from the 3rd month to the 9th month versus the control group. However, there was still further research to refine the curriculum for this intervention program.